is Mindful Monday, and we're talking about lung cancer this morning, the deadliest cancer in the U.S. But there is some good news. New cases and deaths are dropping, according to statistics. Joining us to break it down is Dr. Kurt Edel, medical oncologist at Amplify by Gunderson. Good morning. Thanks for being with us this morning.
Hey, thanks for having me this morning.
Yeah, so we know that screening is a big part of catching lung cancer early. Who should be getting screened?
Yes, good question. So the USPTF, the government agency that says, who should be screened or sets out recommendations, has suggested patients between the ages of 50 and 80 who have at least a 20-pack year smoking history. So now you ask me, what's a pack year smoking history? Good question. A pack year is if you smoke a pack a day for 1 year, that's a 1-pack year history. You need a 20-pack year history to qualify to be screened. Yes. So unlike other screening recommendations, which are primarily age-based, lung cancer is not just age-based, but it's also risk-based, which makes it somewhat complicated. Yes. So, but again, between the ages of 50 and 80, 20-pack year smoking history. Yes.
Okay, so the New American Lung Association's reports show that only 18% of high-risk patients are getting screened, and why is it so low?
Well, first off, 18% is probably high. The real screening rate is probably somewhere around 10%, and it varies quite a lot across the U.S. One of the problems is just what I mentioned, is that it's a risk-based, so calculating risk is not always easy. The other problem that we have with this is that not everybody wants to talk about getting screened. So if you're a smoker, unfortunately, there's a sense of nihilism sometimes, like, why do I want to get screened if I know that I'm at risk for doing this because I'm,
You want to keep living your life,
exactly,
right? Yeah.
Exactly. So it's a discussion that doesn't necessarily happen with the patient and the provider. There's also insurance coverage that plays into this, because not all insurances will cover screening. So and you compare that to breast cancer, colon cancer, which are up around 70%. So we've got a long ways to go.
Yeah,
We've got a long ways to go.
Multiple factors there for sure. And then we're also hearing, about non-smokers getting lung cancer. What's going on there?
Yeah, so the vast majority of patients who are non-smokers who get lung cancer, generally we don't have good sort of cause and effect. But we do know that there's genetic factors, secondhand smoke, environmental factors, and of course the biggest risk factor is radon, which most people don't even know if they're exposed to. But I think as time goes on, we're going to find out more and more about what real risk factors look like for non-smokers.
So a lot of television shows, sorry to interrupt you, a lot of television shows now are showing a lot of folks smoking and vaping. So is vaping a major issue now as well?
Yes, it is. And unfortunately, we're seeing a lot of social influencers promoting smoking as a sort of a trend of which we should all participate.
Or even they say vaping's healthier.
Yes, and vaping is really not healthier. Vaping, what's in a vape is a lot of toxics, including heavy metals. We know that there's about 3,000 hospital admissions, 70 deaths because of vaping. And it increases certainly lung cancer, or not lung cancer, respiratory illnesses. So patients who have respiratory illnesses, COPD, influenza, are much more likely to have further health complications because of that.
Interesting there. It's not a safe alternative.
It's not a safe alternative.
Could they be possibly getting particulate matter as well in the form of plastics as well in that?
Perhaps, yes. And it's not FDA really regulated. So there's really no control over what's in a vape. Which is one of the problems.
Yeah, that's good to know there. And then if you are a vapor, there's no, like you said, that 20-pack a day, there's no real requirement for that for vaping, right?
No, there isn't.
So hopefully more to come there. What can we do to lower our risk of lung cancer?
Well, one, if you smoke, please do anything you can to stop. The problem is that smoking now doesn't really have complications now. It's the downstream effect in years from now that are really the big problem. And it's not just lung cancer, it's cardiovascular risk, it's respiratory illnesses, it's a number of health complications down the road.
Okay, so try to put it down if you can. All right, well, we're out of time, but we really appreciate you, Dr. Edel, for being here with us this morning. Such an important conversation.
Great. Thank you very much.
No problem. Stay with us. We're back right after this.